Hello, Kent County. I'm Dr. Adam London from the Kent County Health Department, here to give you an update on March 19th. We learned today that there are a total of 336 cases now statewide. And unfortunately, there's 2 additional deaths, one of which was an 81-year-old and another was a person in their 50s who had underlying health conditions. Both of those deaths were, again, on the east side of the state. This increase in tests is not really, positive test results is not really surprising to us because the number of tests being conducted has increased pretty dramatically, especially at the laboratories and the hospitals on the east side of the state. I expect that we're going to see a similar increase as testing becomes more available here in the West Michigan area. We did learn today of a couple additional positive tests here in Kent County. That brings our Kent County total to 9 presumptive positives. Yesterday when I spoke to you, I didn't know much about the identity of the 2 additional cases that we learned about yesterday. Altogether, these 4 new cases, yesterday's 2 and today's 2, include 3 people in their 20s and 1 person in their 30s. All 4 are doing well, they're all recovering, but I think this underscores the point that young people are not invulnerable to COVID-19. And we're learning this lesson across the nation. So I'm appealing to all of you who are in that younger age bracket. Let's be mindful of the fact that we can be affected, you can be affected by COVID-19, and you can carry that disease to others who may be more vulnerable in the community as well. This is all pretty concerning with an increase, and again, it's not something that surprises us, but I think that it underscores the point that we all need to really double down on our prevention measures at this time. We've been talking for a while about staying home if you're sick. We've been talking about washing your hands. We've been talking about avoiding social gatherings. And all that is sound public health advice. I also want to encourage you to limit your unnecessary travel. If you don't need to go out, choose not to. We really should be limiting our travel to those essential things, going to the grocery store, taking care of the basic functions of our life and family. We also know that there are many people who are performing essential services now, working at those grocery stores, or doing first response or healthcare jobs. We need to protect them, and the best way we can do that is by isolating ourselves as much as reasonably possible from them. I also want to encourage you to think about your own mental health and the mental health of the kids and the older neighbors and family members that you may have. I had a great conversation yesterday with Kristen Spikerman, the Chief Clinical Officer at Network 180. We had a good conversation about practical things that you can do to help the kids in our lives and the older people in our lives get through this difficult time. This is a time that we all need to pull together, and that's difficult to do because while I'm saying pull together, I'm also saying we need to isolate ourselves somewhat. So let's be creative. How can we support our neighbors, our family members, and those who are most vulnerable while not putting them in additional risk? Let's all think about that. I'm Dr. Adam London, Kent County Health Department. Please continue to like and share these Facebook posts. Thank you.